When we're young, we often take hearing for granted. As we age, we realize how important it is to be able to listen to everyday life. Living with hearing loss, tonight, on Call with the Prairie Doc. Good evening, and welcome to On Call with the Prairie Doc. I am Dr. Andrew Ellsworth. Dr. Holm is off this evening. Most of us have a decline in the ability to hear as we age. It may be due to an illness, working for years in too noisy of an environment, or standing too close to the bass amp in the rock band or praise band we were in when we were younger. Whatever the cause of our hearing loss, there are some things we can do to improve our hearing experience. First, let's take a look at this week's Prairie Doc quiz question. It's a true or false question. 1 in 4 people with hearing problems have it as a result of noise exposure throughout a lifetime. True or false? Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of Dr. Holm's essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We will announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in. Joining us tonight is Dr. Greg Desautels with Sanford Ear, Nose, and Throat Clinic in Sioux Falls, South Dakota. Dr. Desautels, thanks for joining us tonight.
Thanks for having me.
Tell me a little bit about your background.
So I went to medical school at the University of Iowa about 20 years ago. From there, I did my ear, nose, and throat residency at UC Davis in Sacramento. And then I've been in South Dakota essentially for the last 19 to 20 years as an ear, nose, and throat physician, practicing both in Sioux Falls and Watertown and Aberdeen as well.
Wonderful, wonderful. And how did you get interested in ear, nose, and throat?
So at the University of Iowa, actually, cochlear implants is a big part of the University of Iowa research, particularly in obviously in the otolaryngology department there. And so I actually started doing cochlear implant research as a medical student, and subsequently was doing cochlear implants on rabbits, and then decided that when I got into residency, humans would be a better option. So that's really how I got into ear, nose, and throat and wanting to do cochlear implants, and then also just the fascination with all the areas of ear, nose, and throat, including the sinuses and throat cancer, those kind of things. So.
Excellent. So did you dive right into cochlear implants? And first of all, what's a cochlear implant?
So just to tell you, a cochlear implant is very different than a hearing aid. Cochlear implant is essentially an electrode that's inserted, and I can show you right here, inserted into the cochlea, but essentially it's a surgery that helps people to hear who are either born deaf or perhaps hearing aids no longer work for them. And so it actually, now over the last 20 years since we've started getting better, the cochlear implant has gotten better. We've actually been doing it in older patients. The oldest patient that I've done is 91. The youngest patient I've done is 6 months of age. So the age range is pretty vast, but you can take a child who's born deaf and actually their hearing actually can be the same level as a normal hearing child, which is pretty incredible.
So I want to get more into the cochlear implants, but I suppose we should look at causes of hearing loss to begin with.
Yeah.
What are some of the main causes of hearing loss?
So probably the main cause of hearing loss is either aging is probably a big factor, obviously, for a lot of people. Noise exposure can be a big problem. There's also fluid in the middle ear. When you're looking at children, I'd probably say the majority of those kids have fluid or chronic ear infections as the major source of their hearing loss. Now, the other thing that we have to kind of talk about a little bit is the two different types of hearing loss. So there's the conductive component of the hearing loss, and if you look at, and maybe we can pull up the screen here a little bit. So let's just talk a little bit about the way sound comes into the ear canal here, and then what happens is the eardrum right here actually vibrates, and then that sound is taken through the ossicles and put into the cochlea. Okay, so let's see if we can maybe get a little different, bigger. Let's see, large line, let's do that. So let's see if we can, so again, sound comes in through the ear canal and it hits your eardrum here, and that's what vibrates. When you have a hole in the eardrum, then the sound is not transmitted as well into the inner ear. So how are we doing here? So the other thing is that the middle ear has to be aerated. So this point right there, all of that is just air. When you get fluid in there, then it feels like you're hearing underwater.
Yeah.
Okay? So, but once it hits the eardrum, the sound actually gets transmitted through your little ossicles, and there's 3 ossicles. There's the malleus, the incus, and the stapes, and then
The hammer,
the hammer, and the incus, and then usually the stirrup kind of thing. But the stirrup or the stapes has to vibrate in and out of the inner ear in order for there to be sound transmitted. So this, anything with here, and I'm going to just put a blue one here, if we can make that blue. So anything in this area here is usually what we call a conductive hearing loss. In other words, the sound just isn't being transmitted to the inner ear appropriately. And so what happens as a result, then you get what we call a conductive loss. Almost everything from this point, whether it be wax in your ears, which is another common cause of hearing loss, anything blocking this transmission of the sound waves is going to cause this conductive hearing loss. And a big cause is actually cerumen impaction. And a lot of people come in with that, and you can either irrigate it out or just pick it out kind of thing. And you're used to doing that.
I love that. I can help someone right away in clinic.
Yeah, I always say you feel like Jesus. Now, I don't want to take it out, don't get me wrong, but it's just like all of a sudden you can unplug their ears, and it's dramatic. And you've seen it. It's like, wow, the lights come on, or the sound comes on. So, so the conductive hearing loss, a lot of times there is something that we can do either surgically or with medicines to improve that. The hearing loss that occurs, let's say, of aging or of noise exposure, there's 2 different types of treatment. Usually it's a hearing aid is probably the most common, and this is the cochlea. And maybe what I can do is set this up, if we can look at this a little bit. I don't know if we can see that. Maybe that will help just a little bit. That's showing up just a bit. Yeah. So I'm going to just stand up for just a second. So again, if we look over here, this is the cochlea now, and it's a little snail-shaped structure in the inner ear. So if you see it up here, this is just depicting the cochlea, and then you have your little semicircular canals that are associated with the cochlea as well.
And I think people have heard of that sometimes when they get dizziness.
Right, exactly.
This is what's getting messed up
when you talk about like an inner ear infection or that kind of thing, what a lot of people have is an infection of those semicircular canals, okay, which is in continuity with the cochlea. Sometimes you can have an infection that not only affects your balance, but also the hearing. So, but with this electrode, this cochlear implant, we actually are inserting that electrode into the cochlea. But again, bypassing that conductive component. So, but for most nerve loss, for most loss that happens as a result of noise exposure or just aging, a hearing aid is your best option, okay? And by far and away, for most of us who, as we get older, start losing our hearing, it's going to be a hearing loss that's a nerve-related sensory neuro, and so therefore a hearing aid is our best option.
Now, you talked about the ear infections and fluid in the ear. You know, is there a certain number of ear infections or certain length of time before you might have permanent damage at all, or?
Yes, there is. And so if you look at like in kids, and probably one of the most common procedures that's done are PE tubes. And so a PE tube is basically, maybe we have a little better picture of a eardrum here. Let me just see. That's an ear. So a little bit better picture here, and hopefully, but with a PE tube, which is done for kids with chronic fluid, we make a little incision in the eardrum right here.
Push the screen.
There we go. And basically what's done is you get a small tube in there, a little hole in the eardrum, and that will stay for about a year to 18 months and comes out on its own. But in kids, that's what we commonly do for chronic fluid. Now, how do you know when they've had too many ear infections? Usually we say 6 to 9 in a year. We think of, if they're on more antibiotics more than they're off, then oftentimes a PE tube is a better option, and you probably have your own. Everybody has a little criteria for the recurrent ear infections. The other thing is if you have 3 months of fluid, especially if it's associated with significant hearing loss, then we think of them as being PE candidates.
Now, some of those kids, the tube stays in for quite a while. How long should we let it stay in there before we need to take it out?
So 2 years is kind of the time frame that we start thinking that they're going to end up with a hole in the eardrum that doesn't heal. So 2 to 2.5 years is typically what we recommend. And there are So if there are difference between the first set and, let's say, the second or third set of P tubes, because about 25% of kids who have one set of P tubes are going to go on to get a second set. So these would fall out, and then so those kids will sometimes have what we call permanent tubes, or another name for it is like T tubes a lot of times. And those are tubes that we actually will take out in the office. They aren't going to fall out on their own. There's something we take out in the office. And it's very easy, but it's really after about 2 to 2.5 years, you should at least go back and have it evaluated whether we should take them out.
But does that tube in the ear affect their hearing at all?
A little bit, there is. Believe it or not, there is just a tiny little bit of probably 20 decibels of low frequency hearing. It's not enough that it really doesn't affect them at all. But if you test them out, you'll see at like 250 hertz, there'll be a little loss. But when we talk about the speech banana, where you actually use your frequencies, it's between 500 and 2,000. Okay. So that really doesn't affect you in terms of being able to understand language.
And so when they take the tubes out, that hearing comes back then?
Yes,
once the eardrum heals.
Yeah,
up.
exactly. And it's really such a minor amount that it's really almost unnoticeable. It's unnoticeable for the most part. But yeah, it does come back. The cool thing about tubes are most of the time when we put a tube in and they fall out, there are times, and you've seen this too, where you can't even tell that they've had tubes because the eardrum is so amazing in terms of how it heals. Now, there are other kids who have had tubes, and you do see a lot of like scarring kind of thing. But it isn't scarring that's causing any hearing loss. Okay. So parents need to be kind of aware if somebody looks in the ear and says, oh, gee, there's a lot of scarring, that almost never causes any hearing loss.
Good.
So,
good. Well, establishing a baseline of your hearing is an important step in deciding on the proper treatment.
Audiology, it's a profession of evaluating and treating hearing loss, balance disorders, tinnitus and ringing of the ear. We work with anywhere from the newborns all the way to the geriatric age. A lot of our practice is really based on hearing aid dispensing and really improving people's quality of life through better hearing through hearing aids. Our first responsibility for our patients is a medical exam, and so when people come to see us, usually something has happened to trigger why they've come in. It could be a sudden hearing loss. People are just beginning to notice that they have difficulty hearing, understanding speech. Oftentimes, unfortunately, it takes somebody 7 years to come and see us. 7 years prior, they have found out they feel that they have a hearing issue, but it takes them 7 years to finally come into our doors. So we're trying to improve that if we can. But when somebody does walk into our office, we do a thorough case history. It's a medical case history. We look into their ear canals to make sure it's not an earwax issue, make sure the eardrums are functioning and there's no holes in them and such. And then we bring them into our soundproof booth and we have a thorough exam where we actually are looking at giving them beeps in their ears and allowing them, or helping us see where they hear and how they hear in certain pitch levels. The majority of hearing loss is due to age-related. As we age, our little tiny hair cells that we have inside of our ear, our hearing nerve, they deplete about 0.5% per year of our life. So by the time we hit a certain age, especially over 60, you're going to have some type of a hearing loss. When people get their hearing aids, you cannot just let people go out into the world with hearing aids by themselves, just with the volume. The brain has to do a lot of changing. And so we spend a lot of time counseling our patients regarding what expectations they have when you have that first volume coming back. If remember, these patients may have not heard for 20 years. And so that system is not used to all this sound coming in. And so we have to counsel a patient, explain that your neural pathway, the hearing pathway in your brain has to form again. So the more severe, the different type of product we have to do. You may see people that have like an ear mole, like a piece of plastic in their ear, then the tubing comes up and then the hearing aid sits behind their ear. That is more for power, for people who need power, who have a more severe hearing loss. If somebody has more of a mild hearing loss or moderate hearing loss, then we can do the really thin tube ones, the really thin tube that come up and sit behind the ear that way. Those are then more effective. If they have normal hearing in low pitches, they can still hear that hearing without plugging their ears up, but we're giving them back the high pitches they need from that device. If it is a hearing aid or other kind of assisted listening device, then we will walk hand in hand with them as well in that process to make sure that that's a positive experience.
We answer your medical questions about hearing loss as they are called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. And we already have our first question. So a 75-year-old man from Huron would like to ask, what can you do for constant ringing of the ears?
Okay, so this is an incredibly common problem, common issue. Everybody, especially as we get older, complains of ringing in the ears. A lot of times it is related to noise exposure and hearing loss. So the first thing I tell them is there aren't really any medicines out there that are going to take that ringing away. We do want to do a hearing test because that's probably the most important thing to see if it might indicate something more serious. So assuming it's just a ringing that's associated with a mild sensory nerve hearing loss, a lot of times hearing aids are actually your best option to treat the tinnitus. But I tell them it's not going to take away the ringing that happens, when you're going to bed because you take the hearing aids out and now it's quiet. So there are some things that you can do to maybe background noise where you just, put a fan on the radio, background noise from the radio kind of thing. That can be helpful. I really would say that a lot of tinnitus, whatever the medicines that they're selling you, is a lot of black magic because there's no good studies out there.
So what about zinc? I mean, so tinnitus is ringing of the ears.
Right.
And I've heard some people say zinc helps. Have you heard of that before?
Oh yeah, I've heard it all.
Yeah.
You name a drug, you name a medication,
Okay.
I've heard them all that they've helped. There really is nothing out there. There's something called tinnitus, that's literally the name of the medicine. That really doesn't have any great double-blinded studies to show that it helps. I will tell you, if I give you a sugar pill and I tell you that it's going to help your ringing, 30% of those patients get better.
So, but now it could be a reason for maybe they're taking too much aspirin or something
It can be.
like
That's
that.
a pretty rare situation. I think that in my career, I've probably seen 1 or 2 people that have been taking too much aspirin that's caused their ringing. It's not the baby aspirin you take for your heart problems. It's really, ringing in the ears is just such a common issue that it's very difficult even as somebody who wants to help people and fix their problems, because when they come in with ringing, almost always, unless they're a hearing aid candidate, it's very difficult to get that to be better. Now, I will counsel them that a lot of times it will get less noticeable. So that is one thing that patients need to be aware of. Usually stress will make it more noticeable because the brain isn't able to block off that ringing anymore. So stress, not sleeping well, those things make the ringing seem louder and more difficult to block out.
Yeah.
So.
I've got another question here. A 76-year-old woman from Mitchell would like to know, would a cochlear implant be a possible solution if a baby is born without an eardrum? And what would be the prime age for a cochlear implant?
Okay, that's a great question. Okay, that kind of goes back to a little bit of what we talked about before in terms of if somebody doesn't have an eardrum, or even let's say, and I'm going to draw on here again, let's say the ear canal, sometimes kids are born with stenosis of the ear canal, so it's a blind pouch. So theoretically the sound can't get into the middle ear or into the eardrum at all. Those kids really, most of the time, if we fix that blockage, so if we open up that ear canal, or if we repair the eardrum, and let's say we can replace the eardrum, a lot of times that sound can actually be improved, or I would say their hearing can be improved, such that they don't need a hearing aid or a cochlear implant, okay?
What do you use to make a new eardrum?
So the cool thing is that actually, we actually use some fascia from behind the ear here. The other thing that we do, and I don't know if we can actually see that, but underneath their muscle, and let's actually go back. Can we just maybe go back to this one here for just a second? So if you look at, actually when we make our incision, underneath of or over the muscle is actually the temporalis fascia, and I don't know, it maybe doesn't show up very well here, but there's actually fascia that you can take that you
Tissue
from the body that you reconstruct the ear from. And you can either use cartilage from the ear itself, or you can use this temporalis fascia to reconstruct the eardrum. The cool thing is if you use cartilage, and we take some cartilage from out here and we put it into the eardrum, the hearing can be just as good as the saran wrap that the eardrum usually looks like. So. Now back to our question, if you don't mind, just back to our question. What age? So let's say somebody is born deaf. So let's say the cochlea isn't functioning well. Okay, so they have a normal ear canal and everything, but the cochlea is not working. So they have a sensory neurohearing loss, congenital deafness, hearing aids aren't working for them. So you want to implant those kids as young as 12 months of age, even down to 6 months of age. So to get the best results, the earlier you implant those kids, and we usually do implants in both ears, the better the results are.
In further development, I'm sure.
For their
too.
development. But the cool thing is that even if somebody develops hearing loss a little bit later in life, let's say 2 or even older than that, we'll still do the implant in the kids, and they still can function as well as the kids of the same age as them. So and in that situation, let's say somebody develops meningitis. Another common situation is a child who develops meningitis. Infection, and they lose their hearing. And so then they're a good cochlear implant candidate, and usually we do that at about 6 weeks after they've had the infection, and they usually function very well.
Do they need to have that replaced as they get older then?
The
and get
fortunate
bigger?
thing is, and maybe I can just show you what the electrode itself, what goes into the inner ear does not, but the outside piece, which is this speech processor, and I'm going to just kind of put it on here a little bit, but this is what the implant looks like when you have it on, okay? And so there's a little magnet that's attached, and I don't know how well it shows up. But so when we do that, we can actually take this little speech processor here, and we can actually just replace that. And so it's just similar to a hearing aid in that when technology gets better, you can just take this off and they'll send you a new one, or just go into the audiologist and you get a new one. And about every 2 to 5 years, because technology is changing so fast, they'll update the speech processor. So this is external though. This is what goes on through the skin. There's a magnet that actually this attaches to underneath the skin though. If you take this off, you can't see anything or even know that somebody's had an implant.
And now, so say someone it just isn't having good luck with hearing aids, and will insurance cover a cochlear implant for them?
Yes.
Will Medicare cover it?
Medicare covers cochlear implants very well. I was just talking to somebody before the show, and I said, you know, if you have Medicare and a supplement, the out-of-pocket cost is probably between $100 and $200, as opposed to hearing aids, which are $5,000. Now, the patients, sometimes they'll come in because they're like, well, I'd rather pay $200 than $5,000 for hearing aids. But your hearing has to be bad enough that you can't benefit from hearing aids. So, you know, it's one of those situations where hearing aids are your first option as an adult. Even as a child, they're your first option. And then cochlear implants, but insurances will pay for them.
Now, I understand you do some missionary work or outreach to Dominican Republic.
Right.
And are you doing these things for them down there?
Yes, we are trying. And the challenge with it is, I say, I do the surgery, and so, but the audiologist who does the follow-up rehab is really the most important person. I get the fun part, which is the surgery, and I say it's easy, that's relative, but the hard part in the Dominican and some of these other countries are 2 things. One is they don't have great audiology. So I can do a cochlear implant surgery, and they are done, but the follow-up with the audiologist is difficult. The other thing is the batteries are rechargeable, and while we have a constant supply of electricity, in third world countries they don't always have that. So it's the power that kind of, even both for hearing aids but also for cochlear implants, if you can't recharge the batteries, the cochlear implant isn't going to be functional. It's a challenge. I do lots of ear surgery at the Dominican, but in the Dominican Republic, but not so much of the cochlear implants, because unfortunately you have to have a steady supply of electricity and an audiologist to do the rehab.
Right. An 82-year-old woman from Sturgis would like to know if hearing loss is hereditary.
Absolutely, yeah. There's definitely a genetic component to hearing loss, and you see that in the kids that are born deaf, but also as adults, there's a predisposition for noise-induced hearing loss. So some people can walk around with the boombox, and this is, I'm dating myself, but walk around with the boombox on their shoulder, and not have any hearing loss at all. And there's other people who can, you know, have a transistor radio playing and will have a certain amount of noise-induced hearing loss. So it's definitely genetic. Even how much hearing loss we lose as we get older is genetically kind of programmed for us. We can modify that by not having noise exposure, but there are some people that lose their hearing faster than others.
Yeah. Also, a man from Sioux Falls says he has Parkinson's disease and wants to know if the imbalance he feels is from the disease or from his hearing.
That is a great question, and I would say it may be multifactorial. I would definitely say Parkinson's is playing a role in the imbalance that he's feeling or having, for sure. But also, just like our hearing diminishes as we get older, so does the function of the semicircular canal, so the little balance
Yes.
structure that we have in the inner ear. So I would say it's probably multifactorial. But inner ear, let's say, balance issues, usually it's vertigo. So if the room is spinning round and round, then that's probably an inner ear problem. If they just feel unsteady, either when they first get up, or if they're just kind of walking wobbly and unsteady, that's probably mostly from the Parkinson's.
Sure.
So, and we see it a lot where we see a lot of dizzy patients who really have, it's 2 or 3 different causes. It's not just an inner ear problem. It's, their nerves aren't working well because they have diabetes or something like that. So.
Yeah. Another question from a 20-year-old woman from Sioux City, Iowa, who wants to know if Q-tips are as dangerous as people say. So I'm always telling my patients, don't stick anything sharper than what your elbow in your ear, right? Or I usually tell them just leave the ears alone.
Yeah, and I would say that is the best option, is just to leave your ears alone, okay? Yeah. But if you start using Q-tips, the challenge is that you will continue to want to kind of keep using them, because the wax really is protective. It keeps the ears from healthy, they are nice and moist, it's bactericidal and that kind of thing. But once you start using Q-tips, you start pushing half the wax in and half the wax out. Yes. Now, I will say that I'm okay with using Q-tips, because a lot of times patients, and there are 98, 99% of patients who probably use Q-tips who never have an issue, okay? The trouble is that you don't know whether you're that 1 or 2% right early on. So Q-tips are not as dangerous as people talk about. There really isn't that big of an issue unless somebody bumps you and then the Q-tip goes through the tympanic membrane, and I have seen that. So I would say in most situations, most people get by fine with using Q-tips, and what else do we have? I've heard it all. One of the patients felt guilty. I said, what do you use to clean your ears? And he looked at me sheepishly, and I said, well, I bet it's a bobby pin. And sure enough, he used a bobby pin. So I'm like, okay, I've heard it all, and there's nothing you're going to tell me that. So I'd rather have you use a Q-tip than a bobby pin. So, and it's all relative. If you can do nothing, that's best.
I know, because I feel like, it's rewarding. You get a little bit in there, but you're pushing that in. And so if they come to see me, if they haven't done anything, I can easily get whatever's sitting there out. But if it's all blocked in there, it's in there. A 76-year-old woman from Worthington, Minnesota, says both her and her mother have experienced hearing loss. Is there a certain age in women that this sets in?
So that's somewhat of a challenging question. I will say, if we want to talk about another diagnosis or disease, it's called otosclerosis. And otosclerosis is where the stapes, this little stirrup that we talked about before, it gets fixed. And maybe, let's see.
Maybe a bigger circle there.
Yeah. So if we can do, so that little stirrup there sometimes will get fixed. And what happens is then it gets stuck. And the reason it gets stuck is because there's new bone that forms around it, and so it's frozen. It's kind of like the piston in your car. The oil is kind of frozen, or it's not moving anymore, and so we can unfreeze that. That is inherited, and a lot of times that may happen in between ages 20 and 40. A lot of times it happens in women once they become pregnant, because the metabolic rate is increased quite a bit, and so you'll hear or see a decrease in their hearing. So the answer to that is that there isn't any specific age, but I would say more of the conductive or, let's say, those kind of losses that are a result of the ossicular fixation occur in your 20s to 40s. Kind of thing.
The technology and effectiveness of hearing aids has improved dramatically over the years, but it may be vanity that holds us back.
I had hearing impairment first, probably genetic, an accident in the military that caused deafness for a couple days. I've hunted my whole life since I'm 14. I was in the rock and roll business for 6 years. So somewhere in there I did some damage. Several males in my family have hearing impairment, and that was what I started with. All the equipment is up here, and it's outside, and they can pack a little more power and a little more science into it. Maybe picks up the sounds better, and then of course it transmits down along this wire into a little speaker right here. The other kind is ear in the canal, and that's very popular. And that's what I started with. See, the digital ones that When I became aware, I was 50 years old, so I was about 18 years ago, and that's when they first started coming out, and I had in the canal hearing aid. And that's a little bit of the vanity of the whole thing, because they hide a little better. Some of it I didn't miss because I had never experienced, but my wife will tell you that the first time I ever had hearing aids, I came home, went outside. She was sitting outside on the porch there. I said, "What is wrong with those birds? Holy buckets, they are going crazy." She says they sound like that all the time. Duck hunting is much louder, and especially the environment you're in, you're somewhat in the rushes or whatever. I wear head earphones. I initially just had protection, but after my nephews got upset with me saying, "Get down, get down," and me not just standing there, and then they'd have to grab me to get down because some waterfowl were coming, then I got the ones that have a microphone. I was a little disappointed when I got my first hearing aids because I expected them to be like glasses. And now I never paid any attention to the word aid, and these are corrective. These correct, when you put them on, you can read and see as you should. And when you put hearing aids in, they only aid your hearing. It's not perfect. It sounds a little electronic. It's not as natural. It's not perfect, and it has those drawbacks, but it does really, it's worth it. I always tell people, sure, and get hearing aids. If you're having any problem whatsoever, you'll get over that 30 days, you'll really enjoy your life a lot more.
This is your show, and your questions are key to our show discussion. Call in your questions about hearing loss to 1-888-376-6225 or send us an email to ask@prairiedoc.org. So a few weeks ago, I went to the Vikings game. And it's a loud place,
Very loud.
that stadium. And thankfully, my mom sent with us some earplugs.
Yeah.
And I thought I'd never really used them much, but they worked really well.
Yeah.
What are some things you'd recommend that when we use earplugs for the common person? When should we use earplugs?
So pretty much any time that you're going to be exposed to, lawn mowing, any kind of noise that's going to tend to, constant noise actually is a little easier to drown out and a little less damaging than the sudden loud noises like, jet taking off or even running a lawnmower, that kind of chainsaw,
Or
those kind of things. Or
fireworks, if we're
fireworks.
watching a fireworks
yeah,
show,
exactly.
should
So,
we-
and you think about it like hunting. You think about shooting. Okay, that's probably one of the most kind of noise damaging kind of sports that we do. And so, wearing hearing protection, and they do have some that will actually block out that sudden loud noise. I can't even remember the game kind of hearing protection that actually works really well. And then you can still communicate, you can talk, carry on a conversation, you can hear the birds, that kind of thing. So those are what I typically recommend for hunters, kind of thing. But anything that actually will block, you can use a cotton ball with Vaseline will work, kind of thing. I'd say the better ones typically are the ones that have the little foam in them, that are reusable. One of the challenges with that is you tend to, if you use them a lot, you'll push the wax in there.
Right.
A lot of times they build up,
Yeah.
and so a lot of times patients will come in to get the wax cleaned out if they've been using. The other thing are the big earmuffs, and sometimes if people are around a lot of noise, especially in construction, I'll recommend both, the foam inserts, but then also the more of the, and I think we've got a picture, more of like the over the head, these
Yeah.
right here kind of thing. So you can use these inserts right here per se, and then you can also just add on them the earmuffs, the protection that actually go over the outer ears are actually effective as well. So
when I'm mowing the lawn and I've got some earbuds, my iPhone earbuds, in,
Yeah.
are they giving me some protection?
they are, yeah. Actually, it's not a bad idea just to wear, especially good sound canceling, either earphones or earbuds kind of thing. So yeah, they are giving you some. It depends on how loud you're having the music. So that is an issue.
Right.
So if you got it at 10 as opposed to
Right.
2, that's not going to help you very much. But yeah, they do give you some protection.
Sure. A man from Pierre wants to know, why do hearing aids cost so much?
Okay. My honest answer is, I don't know. Okay. The challenge with it is that hearing aids are usually, you think about it, like a hearing aid typically will cost between $2,000 and $2,500 per hearing aid. Okay. But if you think about that, that lasts between 7 and 10 years. So I try to explain it to the patient and say, okay, listen, you're going to have this hearing aid potentially for 5, 7, 10 years. So that money that you're spending, okay, for one thing, the audiologist, whoever is selling them, they're going to give you a free service typically for, 1 to 3 years afterwards. And so service, it's all about service.
Sure.
Hearing aids cost a lot because the audiologist who's servicing that patient afterwards, there's not a lot of reimbursement that happens during that, especially for the first year. And I also try to, the caveat is, think about it as this is a 10-year investment, and this is an investment in my family, and so my family's not annoyed. Yes. There are hearing aids that are less expensive than others. You can get them online for, maybe 10% of what you can, buy them at a retail place. The trouble is there's nobody servicing it. Yeah. And if you don't like them, usually they end up on your drawer next to the bed kind of thing.
How can you put a price on being able to talk with your family and hear your grandchild, which, hearing loss, I understand, affects higher frequency pitches usually.
Typically, yep.
And so do the hearing aids help bring that back?
Yes, and the cool thing about hearing aids is they're programmable. So in other words, especially the ones that are kind of middle of the road or higher ends. So if you look at, let's say you have just a high frequency hearing loss, a programmable hearing aid, which is digital, will actually be able to amplify just the high frequencies and not the low frequencies. And so that's the nice thing in terms of they're just more comfortable to wear. Now the trouble with hearing aids too, that we kind of talk, I want to counsel you, is that not every person who has hearing loss is necessarily a good candidate for hearing aids. There are some people who are going to struggle more than others, because with hearing loss, sometimes your ability to understand the words can be very challenging. And so just because we amplify the sound doesn't mean that it's more understandable. And a lot of people really struggle with hearing aids because their word understanding is still poor, even at high levels or high volumes kind of thing. So, but that's difficult. That's where it's good to go to an audiologist, somebody who's reputable. You don't always have to go to an ear, nose, and throat physician kind of thing. And there are lots of different types of hearing aids.
So is this, the technology I'm sure has changed in the last
5 years,
10
years. We used to have an analog. It was like having the big tubes in your TV, and now they've gone completely to digital, where they're very sleek, they're very small.
You can find them with your phone now too.
Exactly, the Bluetooth, and you can upgrade them with your phone, and I mean, and the cool thing now with cochlear implants too is we're doing an implant in one side and using a hearing aid in the other, and we kind of talked about the fact that those can talk to each other kind of thing. And if you look at the different types of hearing aids, this one here I would say is probably the least expensive because it's the most visible to the other patients. This one here is kind of a little bit like, I use that as like a reading glasses. That you can slip in and out, and if you look at just this area right here, there's really nothing occluding the ear canal kind of thing. Yeah. So the cool thing now with hearing aids is that like you can slip that into your ear and it's almost unnoticeable to the average other, the public kind of thing, or to your grandchild or whatever. So that's the cool thing. But now with technology getting better, it's more expensive. And that's part of the reason that hearing aids have gotten more expensive, because the technology has gotten better, but unfortunately that's at a cost.
Right. And are batteries very costly too?
They can be,
I was talking with my grandma about this, and she said a lot of her friends don't want to wear them because they don't want to mess with the batteries, or they don't want to pay for more batteries. They want to save it for when they need it, but then they don't end up using them.
Exactly. And so what happens, there's kind of two ways of getting around that a little bit. A lot of people will actually supply, like the audiologist will supply free batteries for up to a year. So, and usually you have to change them about every 3 days. More commonly, though, are the rechargeable batteries. And so, like, you'll get a set of hearing aids, and basically you take them out at night, you just plug them in, and then you just pick them up in the morning and you're good to go. And you might need to change that rechargeable battery maybe once every 3 to 6 months. And I won't claim to be an audiologist, but so if an audiologist is out there knows different, they can send in their question or correction, say.
We haven't talked about acoustic neuromas yet. Here, a woman from Redfield had acoustic neuroma in her ear and says it feels like she was only hearing with one ear. Would a hearing aid help? So first, of course, what's an acoustic neuroma?
So an acoustic neuroma is basically, it's a benign tumor that actually occurs on the balance nerve. It actually occurs in the sheath of the balance nerve, and it actually occurs in the area behind the cochlea, where we call the retrocochlear space. So the nerve comes in, so here's your nerve, but from the brain would be over in this area right here, per se. And then you have your vestibular nerve, which is the balance nerve, and maybe I better do a different color for that one.
So obviously, hearing aids and even a cochlear implant aren't going to help
Because it's all past here. So here's where that acoustic neuroma occurs. Okay, so it puts pressure on the hearing nerve and destroys it. So really, in those patients, the best choice is what we call a cross aid, where we actually take sound. It's basically you wear a microphone on this side, and it takes the sound to the other ear using basically a speaker.
And then you're using your good ear.
You're using your good ear, exactly. Now we do have, the other thing we haven't talked about are what we call BAHAs, which are bone-anchored hearing aids, which are extremely nice now because they're all done under the skin. And so in this situation, the amplification is actually, it's drilled into the bone, so your bone would be here. And then on the outside is just a magnet, very similar to this. But what this does is it actually stimulates the cochlea on the other side of your ear. So it makes it seem like the sound is coming from the ear that is what we call dead, but you're actually using the cochlea on the other side. So a bone-anchored hearing aid is a great option for a lot of patients, especially with acoustic neuromas. Probably that's what I would recommend for her.
A 76-year-old man from Brandon feels like he has experienced ear itching as he has gotten older. Is there anything such as an ointment that you would recommend as a solution to this problem? And are ear mites a thing, too?
I have no idea if ear mites are a thing. People do get allergies in their ears. I mean, the skin, just like it gets sensitive on the outside, the same skin that lines the outside of the body also lines the ear canal.
Or psoriasis.
Or psoriasis, exactly, or dermatitis kind of thing. Now, the thing about the ear canal skin is that it's extremely sensitive because it's right up against the bone. So it's probably one of the thinnest layers of skin that we have.
Which is why you have to be careful sticking something in your ear.
Why we don't recommend Q-tips. Yeah, that's a good point. Exactly. So the reality is what I typically will recommend, and it's easy. I mean, there are just hydrocortisone cream, and it's going to sound like it's just too simple, but it's over-the-counter cream that you would use for a rash. Actually can be very effective for the dermatitis and the ear canal itching. Now you have to be a little careful because the only way to get it in is using Q-tip, but if you're real gentle with the Q-tip, it's what I often recommend. Now there are other treatments. You can use olive oil and that kind of thing, which sometimes helps, although unfortunately that olive oil usually goes all the way into the eardrum, and then you get a little plugging right here, and so it doesn't really help with that. So the easy answer would be just a little bit of hydrocortisone cream, just 1%, it's over the counter on a Q-tip. And if that doesn't work, just see your primary care because they could give you some drops that work very well.
An 83-year-old woman from Sioux Falls wants to know what would cause her husband's ears to keep plugging up. I think we're talking about selective hearing.
I always say, and I always tell patients, I say, I can help you hear better. Listening is up to you. So that's really the patient's option. So,
but they could go get tested. They could see an audiologist.
I would say 99% of the time that's probably just wax building up in the ear canals. Almost always it's something simple, easily treatable, and really, just a quick check could take care of that or figure that why that is, kind of thing. Now there is another plugging that happens to a lot of people, let's say off an airplane, and this could be the other issue is, when you get off an airplane and your ears feel like they're plugged, okay, and we haven't really talked about, but this structure right here is called the eustachian tube, and we always talk about eustachian tube dysfunction. That's what's happening when you get off of an airplane. Your ears are plugged, you feel like you want to pop your ears kind of thing, and that's very safe. Don't worry, but there's some, but what happens sometimes is, because of allergies or whatever, this will plug down here, which makes you more prone for getting that ear plugging sensation and even fluid in there. There is a new procedure just approved by the FDA for actually doing a eustachian tube dilation. We actually put a balloon in here, and it's very cool. I think I'm the only one in South Dakota that's actually done this, so I don't know if that's good or bad, but it's very effective, and patients love it. We actually just put a balloon in there, dilate open the eustachian tube, and then that ear plugging sensation is oftentimes dramatically better. I mean, it sometimes completely goes away.
Now, for sometimes just antihistamines could be helpful.
You bet.
Allergies cause this a
Yep,
lot.
yep.
Those colds and flus and sinus infections will cause this.
Yeah,
sometimes, and then you just have to wait it out.
Exactly.
sometimes.
And usually the best thing I tell people is just time. Time really is the best option, or a decongestant,
Right.
like you said.
And Sudafed, now we have to go behind the counter
Yeah,
for the
right.
for the good stuff.
Right, exactly. So yeah, and typically, you can get the smaller doses, which probably is going to work okay. Sudafed does have a little bit of side effects to it. You have to worry about it with people, if you have trouble urinating or heart conditions, that kind of thing. So you got to be a little careful with
your
Sudafed.
doctor.
Yeah, exactly. There you go. Ask your doctor. So yeah.
A 62-year-old woman from Anton, Iowa wants to know, do the doctors recommend eardrops for clearing earwax? And do you need to get a store-bought solution, or can you create a homemade mixture?
Okay, that's a great question. The simple answer is there are no good medicines that are really going to soften the wax up to the point that it's going to come out on its own or more easily. There are cerumen, so I would say no. In general, the best way to do it is get it cleaned out completely as well as you can, and then there are some drops that can be effective. The thing like with swimmer's ear that I often will recommend for patients, let's say, is to use a third vinegar, a third alcohol, and a third water. It's like 3 equal parts, to use that in the ear to kind of prevent, the swimmer's ear, the typical swimmer's ear.
Yeah.
Now you could use that as well to try to see if you can get some of the wax coming out of the ears, but in general there's not anything good, because what happens is the cerumen softens up, but then it actually goes more in than comes out.
Yeah.
And then we struggle to get it out because now it's up near the eardrum where it's real sensitive.
Same type of deal maybe with candling. Is
Oh,
that
yeah.
beneficial, or is that
Well,
potentially dangerous?
potentially it's dangerous, although usually they're not doing any harm. It feels good, but very rarely do they actually get much wax out, even if you have a lot of wax in your ears. So I have seen somebody that pulled the eardrum off, actually had the ear candling literally rip the eardrum off because it got behind the little cotton or whatever they're using. But in general, it's kind of a gimmick. If it feels good, that's fine. But for $25, there's probably better ways to spend your money. So,
I think, once again, maybe just try to leave your ears alone
yeah,
if you can.
If you can, exactly.
A 75-year-old woman from Sioux Falls has collapsed eustachian tubes in both ears. So I think the question is, what can help? Will that procedure help? You
It will, yeah. And it's pretty amazing but recognize it's not just that we're dilating open the eustachian tube. We're actually changing the mucosa actually in the eustachian tube. So it isn't so much the dilation in terms of like changing the anatomy. We actually change the mucosa in there and the lining, and the histology is such that you actually change the inflammatory cells and decrease the inflammatory cells that are in the eustachian tube. So in that situation, maybe. If it's truly a collapsed eustachian tube, but usually people don't know the difference between just a plugged eustachian tube versus one that's, I think she's probably a candidate, but I would have to evaluate that a little further. So.
And now for the winner of tonight's Prairie Doc quiz question. It's a true or false question. 1 in 4 people with hearing problems have it as a result of noise exposure throughout a lifetime. True or false? The answer is true. It was Tom Sorensen from Sioux Falls, South Dakota, who answered the question correctly. Thank you, Tom, for participating, and a book will be in the mail to you soon. So 1 in 4 people, we'll get that. We've talked about ways to prevent it, to protect your ears, but some of it just comes with age.
Right.
And we've talked about how hearing aids can help. And just one thing I wanted to cover still yet is, and when do you know when a person should maybe look at getting a cochlear implant then as an alternative to a hearing aid?
Right, and that's a great question. And sometimes it's the only way to know is to actually be tested. Now, what I usually tell people or patients is to say, if you can't hear on the phone well, if you're struggling to hear on the phone with or without a hearing aid, that's a good indication you may be a cochlear implant candidate.
We'll be right back after this.
Good day, citizens. It is with regret that I inform you that the end is near for me. I'm old, I'm tired, I'm weak. But don't go thinking that you've won the war against the flu. Before I go to that big petri dish in the sky, I will find a suitable replacement. be warned.
Of the 40 million people with hearing loss in the United States, 25% of those, or 10 million, have lost hearing resulting from exposure to too much noise. But how much noise is too much? Measured as decibels, the acceptable manufacturing noise standard is to allow a daily exposure up to, but not over, 85 decibels in an 8-hour period of time. More than that can cause permanent injury to our hearing. This is likely due to wear and tear on the tiny little hairs that vibrate when sound is introduced. It's like a daily line of college kids walking too often across one path on the grass. A little is fine, too much kills the grass. The average conversation, for example, is usually around 50 to 60 decibels, street noise is at 70 to 80, and an operating lawnmower at about 90. Single loud sounds like gunfire at about 150 can also be damaging, but realize that the time exposed to lower volumes are the unrecognized danger we face daily. Noise levels above 90 come from surprising places like screaming babies, convertibles driving at 60 miles per hour, marching bands, leaf blowers, hand and hair dryers, and those noisy electronically amplified concerts. Now a new threat has turned up. Tuning out the world with earbuds while turning up the tunes for hours can be like riding on that 2-cylinder John Deere tractor with no cab all day while cultivating corn. Those old 2-cylinders were really loud, and so it can be with earbuds. Earbud volumes at 100 decibels for as short as 15 minutes can damage hearing. Again, it's the volume multiplied by the time that makes it so bad. One study showed that 97% of third graders had documented exposure to hazardous sound levels. And another showed that 12.5% of 6 to 19-year-olds in the United States already had hearing loss directly attributable to noise exposure. What's more, earbuds can be even more dangerous if the volume is too high, blocking out the ambient outside noise, which is needed to avoid danger. For example, walkers, runners, and bicyclists need their ears to hear when a truck might be coming from behind. Of course, it isn't just noise that can reduce our hearing. Infections, trauma, and even medications like antibiotics, chemotherapy drugs, or pain medicines can do it too, and we need to be aware. But more than that, we need to take home this message, for today is to protect ears by avoiding exposure to too much noise, and that the noise from earbuds is a new and dangerous threat.
A big thank you to our guest, Dr. Greg Desautels, for joining us tonight on this important topic of hearing loss. While the flu is having a slow start this year, it will grab hold and many more cases will arrive. Do not delay. Get your flu vaccine now to reduce your chances of catching the flu bug this season. That does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there.
Can't get enough of the Prairie Doc? Then visit our webpage and other online programming. You'll find extended interviews with guests and more information on important medical subjects. Visit prairiedoc.org or follow us on Facebook. The best way to stay healthy out there.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota.
And with the ongoing support of these individuals and institutions.
Brookings Health System,
Ophthalmology Limited,
South Dakota State Medical Association,
Avera Heart Hospital,
Dakota Allergy and Asthma,
Fishback Financial Corporation,
Vance Thompson Vision,
Aberdeen Asthma and Allergy,
Dakota Bank,
Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
Regional Health,
and Swiftel Communications.